Thank you very much. Can everybody hear me? Okay. There's a number of reasons why I'm happy to be here today. One is, of course, it's Valentine's Day. And also, February is Psychology Month in Canada, so I thought I'd give a little plug for Psychology Month. At the Ottawa Hospital, a number of our psychologists in the different areas give talks across the hospital. If your group wants a talk, it's still not too late, give us a call. So our neuropsychologist gives talks on things like consent and capacity and cancer-related cognitive impairments. Our clinical psychologists give talks on things like managing or dealing with difficult or challenging patients. Our health psychologists give talks on things like motivational interviewing and facilitating health behavior change. And our rehab psychology give various talks, including ones on dignity-conserving care. So the other thing I wanted to mention is that the Canadian Psychological Association, their tagline for February, for Psychology Month, is "Psychology is for everyone." And it's a very good tagline, and so I want to remind everybody that people who are working have employee benefits that include psychological services, and those will include services for your children as well, because there are a number, not at the Ottawa Hospital, but child psychologists who can deal with learning difficulties, etc. And also the Employee Assistance Program, people don't trust it, they think it's not confidential, but in fact it is, I can vouch for that. And then there's a number of community services and agencies. So that's the plug for Psychology Month. Now, the outline today is to talk about the art of caring and compassion, fatigue, and burnout, which was one of the specific topics people were interested in, life balance, self-care, and resilience. Got to tell you, that's a challenge to do in 45 minutes. Any one of these could be a workshop in and of itself, so it's going to be a bit of an overview of these things, and if anybody has a particular interest, you'll be given some resources, if you will, so you can get more information. So I think we can start with, my interest in this area started when I was when I was in training in the area of rehabilitation. I became very interested in quality of life then because I was very challenged at a personal level by the resilience of the people that I was working with. So people, you would think if they've got a spinal cord injury, they're going to automatically become depressed. You would think that that was quote unquote normal. We're not in fact depressed. And people were still playing and laughing and the human resilience. And so I became interested in quality of life. So why do people care? We know fundamentally, if you think about it, that it's very part of meaning for life. And if you look at the Ottawa Citizen or any paper in the city section, you'll see whole sections of what people do to care for others. And it's just a fundamental part of human beings. And it's not just that we care for children or aging parents. We care for each other. We care for our pets. Caring is just so much an important part of who we are. And I can remember when my daughter Faye was, before she could even speak, we were looking at a picture book. And in the picture book, there was a baby that was crying, and my daughter was very attached to her soother, and she'd take that soother and she'd put it on the page for the baby. And so the issue of caring and empathy and love, if you will, seems to be, with rare exception, very much a part of the human condition. But there's also the other side of it. There's the potential costs of caring. When you're in a healthcare profession, and even at a personal level, depending on what's going on in your life, and depending on the type of caring you're doing, there are physical risks, there's psychological risks, and that's especially true for people who are working in a healthcare setting where you're dealing a lot with negative emotions. And those negative emotions don't have to be necessarily anger directed at you. It can be profound sadness, which over time can have an impact on us. Also, we work in environments where there's intensification. There's lots of change that takes place. There's sometimes difficulty recruiting, so we're short-staffed. And then there's organizational issues. There can be long work hours. There can be a sense that you're not doing enough, no matter how much you're doing. And then we also have individuals who are not only caring when they're at work, but they're caring before they get to work, they're caring when they go home. So those kinds of things can be the cost. Even a good thing, a very good thing, as we know, can sometimes be too much. This is not recent. This was 2010. This was the results of a study that Linda Duxbury had done at the Ottawa Hospital that said local hospital staff stressed to the limit. I thought that was an interesting headline. Now, of course, headlines are always going to try to be entertaining, so draw your attention. But what's interesting about this headline is that in spite of the stress that's associated with the work that we do, you don't see people leaving healthcare in droves. That's not what's happening. You don't see people leaving caring professions in droves. And there's a lot of reasons for that, but I think it speaks to what I've already mentioned, which is that we can focus on some of the stressors and the negative aspects of working in a caring environment, but we also need to know that fundamentally it taps into one of the things that we value, which is the meaning that we achieve from caring for others. So I want to ask a question. Most people, when you say, are healthcare professionals more prone to stress? Most people will say yes. In fact, I think it's really important for us to know that healthcare professionals have some characteristics in common with each other. And while many will agree that their jobs are very stressful, healthcare professionals are not more stress prone. And when you think about it, that's an important thing to keep in mind, because people who would have difficulty dealing with the negative emotions or dealing with some of the side effects, if you will, of caring would never have either been able to go through their training or would have dropped out much sooner. So what you see when you see a group of healthcare professionals who are stressed are not necessarily people who aren't good at coping with stress. And I think that's critical in our understanding of what's going on in our environment. Now, are there characteristics of healthcare workplaces or of healthcare workers that mitigate stress? And of course there are, and the first one is that the work is valued. It's viewed as meaningful, not only by ourselves, but when you tell people what you do, most people will say something like, what might they say? Say it out loud, please. I could never do that, which is a compliment, right? In fact, most of those people, well, some people do self-select out of caring professions, but many people are able to care more than they think they can. But one of the things that reflects is a respect for the work that people do. It's also a link between our work and our personal values. If you think of all of the jobs in the world that you might have, there's many that would not necessarily fit your personal values, and people who work in caring professionals, usually that's aligned, and that's a good thing. It's interesting and diverse work, sometimes too interesting, but it's interesting and diverse. It can be challenging, and then there's a variable potential for other things as well. So the point is that it's a mixed bag. What we sometimes get is an interaction between a helping person, a helping character, a loving, caring individual, and the demands of a caring environment. And what that person ends up doing is, this little thing says, everything's great, thanks for asking, is that we take on too much, or we stay late doing more, and it's very hard to set a limit on caring. So, what's the potential impact of caring for the caregiver? Now, you all at a personal level know what the potential impact is. We're just going to review some of those things. The first one is compassion fatigue. Having this Valentine's Day, I could use this heart logo in many different ways. If you Google compassion fatigue, you get 885,000 results. The term is one of the oldest terms, 1950s, used in nursing, and right now the largest literature on self-care, compassion fatigue, etc., is still in the area of nursing, if we're looking at any one profession. There's also other names that this is called, and really you can't work in healthcare for very long without at some point experiencing compassion fatigue, although you may not label it as that. One of the things that people confuse is the impact of caring on us as individuals and compassion fatigue. So for example, if something has happened that you've been touched by and you go home and it's really heart-wrenching, you tell your spouse about it, you start to cry. Some people think they're suffering compassion fatigue. Absolutely not. That's human caring, that's sadness associated with the work you do, that's normal, that's good, that's healthy, okay? That's not compassion fatigue. Compassion fatigue is when you feel uncomfortable and you're touched at a, not just a level of sadness, but a level of being uncomfortable. And if we look at the symptoms, you can see that it's associated with these various symptoms, that like distraction, being unable to focus, and decreased feelings of pleasure, which is very, very different than the sadness that might be associated with a sad case. And it's also associated with stress and anxiety. And one of the key words here that I want you to be aware of is the word stress, because it's going to come back. Then the issue of burnout. That came much later in terms of definitions, and I chose this image for it because really what happens when a person is in burnout is they're not really there. So there's, you know, it's really hard to get at the individual. Compassion fatigue, I really like that. I think it's a very, if you will, compassionate term because it describes someone who cares and is now in a situation where they're having difficulty. Burnout is a difficult term, and it's a difficult situation. It's a real thing. It does happen, but it happens very, very gradually. And unlike compassion fatigue, is much harder to treat, and it can be treated, but it's harder to treat, and it's often associated with other things as well. So if you look at the symptoms, some of the symptoms are similar to compassion fatigue, but it's also associated with things like a lack of a sense of personal accomplishment. There's a cynicalness that can be associated with it, a negativity, and the other, it can also be associated with depression, and is often misdiagnosed as depression, but burnout and depression are not the same thing. The other thing about burnout, and this is more recent literature if you look at burnout, is that people, often it was described as work burnout, but what we're finding out more and more is that people who have a strong social support network, who have good relationships with their families, really don't so much suffer from burnout. So it's not just an issue about the work environment, it seems to be an interaction between the work and a person's home life. Now, some people don't like to hear that. You know, it's easier to put blame when something's going wrong in some concrete, workplace. The good news about that is it means that there are things that we can do to prevent burnout that have nothing to do with the workplace. And I think that's really where the good news lies. Then there's a whole list of related concepts. You've probably heard all of these words. But there's one element in common to all of this, whether we're talking compassion fatigue or burnout or secondary survivor. The common element to all of these is the issue of stress. It's sometimes hard, especially at the early phases, to say, is this stress, compassion fatigue, or burnout? Okay? And oftentimes, it's not us who identify a problem. Who's likely to identify a problem before us? Say it out loud. Family. Yeah, family or friends. They'll say, and then what do we say when they say that? No, oh no, not a problem, I'm fine, it's just I didn't get enough sleep last night, right? So when our family or our friends tell us that there's something going on, we've got to hear it, okay? I think that the other important thing to keep in mind is that if we look at stress itself, stress over time leads to impairment. Impairment, or it leads to distress, which leads to impairment, and impairment over time leads to improper behavior. In fact, the American Psychological Association did a review of all of the psychologists who had misbehaved and either lost their license or were charged with some crime, and found that this stress impairment continuum applied in all cases. In other words, these were not typically people who had started out as not good psychologists and then decided to go off with their patient. It was a continuum that they were able to demonstrate. And I think that would be, I don't know the literature, but I would assume that that's probably true in other professions as well. It has been a while. We've known for a long time that stress has impact on our psychological well-being. It has been actually more recent that we have been able to demonstrate concretely the physical impact of stress on us. And it's at all levels. So it's related to heart disease, it's related to blood pressure, it's related to weight gain, it's related to cognitive functioning, it's related to just about everything. Stress is a very, very dangerous thing. And there's another thing is, look at this poor little, what is this? It's a zebra, I guess. It's hard to tell now, he's only got half of his stripes. But he's looking at himself. And that's what happens with stress. Stress does make narcissists of us all. I mean, it's very hard. It's like if you were to cut your finger or have a huge headache, you focus in. It's like any form of pain where you focus in. And stress ends up doing the same thing. It's uncomfortable, we start focusing in. And all of that is important when you consider the issue of self-care. The good news is that in every situation there's some elements of the predictors of stress that you can alter, and we're going to talk a little bit more about that. So what does self-care do? I hope that you have a good understanding at this point why we need to do self-care, and I'll talk again more about that. But what does self-care do? Self-care really tries to keep that ball of stress at a manageable level where you've got hold of it doesn't have hold of you. What's the alternative to self-care? Okay, we always look for the simplest way out. So we always look for an alternative to self-care. This is a stress reduction kit that you can use, okay? It tells you where, and this is how it works, okay? And that's the bottom line. While taking care of oneself does take energy and time, the alternatives aren't really very good. Now, if you Google stress management, remember what the Google results were for the others. Well, if you Google stress management, you get 93 million plus results. So even though there's a good literature on, if you will, the problem, there's a bigger literature on the solutions. And there's lots of things that people can do to change their relationship with stress. And I've got to tell you, we're talking about the weather this morning and relaxation techniques. I was literally caught in traffic for 15 minutes, having left 30 minutes early to come for this talk, and I was envisioning not getting here. It was extremely stressful. I can't tell you how many strategies I had to use, including just clapping, because it was some physical thing that I could do. But the point is that I wasn't going to just sit there in my misery. Okay, I want to talk about life balance. People often refer to what work-life balance. I don't like the term work-life balance because for me, work has always been part of my life. And if you look at the literature on happiness, work is an important part of our happiness. People who are independently wealthy work just as many hours as people who are not. People who win the lottery often continue to do the jobs they're doing. If you like your work, it's an important part of your life. And interestingly enough, and I'll talk about this, if you like your work, your family will like your work too. It actually increases. It's what's called a family enhancer. So I call it life balance. And basically life balance means feeling satisfied with the time you have available for various life roles. There is no perfect formula. No one can tell you how to do that because everybody's values are different and what matters to them different. And also the balance can change quickly. If your parent falls and breaks their hip, your balance in your life will change. So there is no formula. It's a bit like this. It takes a lot of work to get it right, and it doesn't take too much to set it off. But if you keep your eye on the ball, the principles and the strategies around it, you can always find the way back. The other thing that happens is when the wind blows our way in an unfavorable direction, the one thing we often take off the list of things to do is self-care. That's often the first thing we take off. What I'm hoping to make the point of today is that the last thing you would ever take off the list is self-care. So there's ways to disrupt life balance. You can have work interfering with family, family interfering with work, caregiver strain, and role overload. And this comes from some of the work of Linda Duxbury. The most common, people think that that work is most likely to interfere with family. But in fact, family, if you just look at statistically what's going on for people, statistically, family interferes more with work. But I think what's really happening more and more in this era is the issue of what's called role overload. So it's the almost like play hard, work hard, which I sort of think that's a good way of saying it, but what's happening is people have too many roles and they're taking up too much time and there's just not enough left for the individual, if you will. So if you look at the figure on the left, this is often, I think this is a good description of work overload. It looks like everything's in balance, but you realize it's really quite precarious. It's too much of a weight to carry. It's not going to be sustainable. Harmony, or the yin-yang symbol, is really a more synergistic approach to what it is we're trying to look at if we're looking at it from a visual point of view. The other thing that we have to recognize is that we often, I mean, I don't know if you have this occur in some of your family, but they treat them like, you know, a stranger comes over and they're really nice, but the family member, oh well, you know, let's not bother with them. We often have to be very careful about how we respond to the people that we love the most. And if you look at, I mean, surgeons, physicians, for example, in terms of people who have some of the most extensive work hours, if you look at their families, an orthopedic surgeon's family life was not determined by the number of hours worked, unless it was over 90 hours a week. The family life, the quality of the family life, was more determined by the mood the surgeon came home in. And that if you ask it's the whole issue of quality time versus quantity. And if you ask teenagers or children about what they want from their parents, is it more time or is it less time but better quality? It's less time but better quality. In other words, your mood with your kids, your mood with your spouse, all of that matters more than how much time you give them. So the concept of quality time is a real thing. More is not necessarily better. And the point I made earlier, family satisfaction, or a spouse's satisfaction with their spouse's work was primarily derived from the spouse's own happiness with their work. So if you come home and you say to your spouse and you start, talking about how awful and horrible and whatever, it reduces their life satisfaction. It makes sense. We work as teams. We're part of each other's lives. Okay. So self-care and the art of caring. This is the key slide for the whole talk. This is the one, if you remember anything, this is it. Okay, so when you're on a plane and there's an issue and the oxygen masks come down, what are you supposed to do? If you're with, let's say, your young child, what do you do? Who do you put the oxygen mask on first? Yourself. Why? Right. You need to look after yourself before you can look after others. So that's the fundamental point. Okay. Do we do that? I see people nodding no. And I think and whenever the time gets stretched, that's the one thing that falls off the table. We don't do that. And yet we know that if we do, we can look after people better. And if we don't, we can be at risk for things like compassion fatigue, burnout, and just being unhappy. It can be just that simple. We're not happy. Today I'm not happy, I'm too stressed. Okay. And it's not about self-indulgence. Okay, many of us were raised with a real strong work ethic, and the idea of taking time for yourself was sort of viewed as self-indulgence. This is almost sort of, it's almost something that it's in the ABCs, it's the A of what we need to do. So the art of caring for others starts with a good understanding of self-care. And I like the image of the umbrella, because if you cover yourself out of the rain, you cover others, you can cover others as well. So how do you promote life balance and self-care? You have to be aware of the different demands that are on your time and your energy. You have to be aware of the difference between what you need and what you want. And that's something, my parents told me a long time ago. It took me years to get what they were saying, right? But there is a difference between those two, and sometimes we go for what we want and then find out we're lacking on what we need. And that's a difficult situation, but it's something you can always recover from. And then making the choices in the allocation of your time and energy, and knowing the values to apply those choices, and making choices in keeping with those values. And that's, again, something I think we don't think often enough or deeply enough. So who's the expert on self-care? Well, only you can be the expert on your own self-care, because your life is uniquely different from everybody else's life. And you need to know what your self-care strengths are and what self-care approaches you can be better at. Some people are great at doing the exercise thing, but aren't great at getting the sleep. Some people are great at getting the sleep, but don't take enough time to, self-reflect. So the formula is going to be one you develop. But you need strategies. And I like this quote: living your life without a plan is like watching television with someone else holding the remote control. And sometimes we do that. We find ourselves having, let's say, made a purchase and decided, wait a minute, that's not really what I wanted. What I really wanted to do was go on that trip instead of spend that $2,000 on that thing. Anyway, but having strategies, having a plan, knowing what your values are, all of those things are going to help you to go in the direction you want. So you align your self-care strategies with values. And on the far left is Dr. Gretchen Conrad. She's a psychologist who works at TOH. And this is a picture of her and her husband, her daughter, and her twin sons. They had taken, at the Ottawa Hospital, you can take a prepaid leave plan. So you work for 4 years and you take the 5th off at 80% salary the whole time. Only 2 people I know in psychology have ever done that. Gretchen is one of them, I'm the other. And she took her kids, and how she did that, you can talk to her about it, but out of school, and they traveled the world for a year. Cool. Do you think that cost them something? How'd they work that out? Well, I bet you they planned that for a long time. But there's an example of somebody who works very hard, very dedicated psychologist, does very good work, and still aligns the priorities with the values. So, and the priorities and values with what she did, which I think was really, really cool. This, by the way, is the top of Kilimanjaro. So, strategies, okay? Let's start with the basics. How many people get enough sleep? Go ahead. You do. Hey, we've got 3 people here who get enough sleep. The impact of not getting enough sleep on health is really quite paramount. If you want to lose weight, one of the first things you have to do is get enough sleep. If you want to exercise, one of the things you want to do is get enough sleep. If you want to make any behavior change, the first thing you have to do is get enough sleep. Why is that?
You need the energy.
Sorry?
You need the energy, mental and physical.
That's right. You need the energy. Anything that takes change takes energy, and you need to be rested. And we're very well aware of that. For those of you who are parents, you're really well aware of the importance of sleep if you have kids. Because if your kids don't get enough sleep, it's very difficult to be with them, right? So we make sure our kids get to sleep. The other thing that, and I mean, at the very basic level, it's in order to feel rested. At the far end, the number of people who fall asleep driving their cars and are killed is really quite astounding. In fact, that's considered to be a really major problem right now, is the number of people who fall asleep while driving. We do not get enough sleep. The majority of people do not get enough sleep. So no matter what you do for self-care, the first thing you would have to do, and I'm not giving you a whole list of strategies to engage in, I'm just going to pick on the ones that we don't do very well at, or some people do. We've got 3 people here who do very well at that, and good for you, but many of us do not. And when we get the time pressure, the one thing we cut off is we You know, clean the house, you're sweeping the floors at 11 o'clock at night and going to bed late, right? Exercise. There's a wonderful little YouTube video that's worth watching by Doc Mike Evans. In fact, you can just Google Doc Mike Evans and you can get to this wonderful little clip. And it's basically about how, he calls it the single best thing we can do for our health. I do agree with him on that, but I think if you don't get enough sleep, that's not going to work either, right? Because you're just not going to follow through. Nourish relationships. I made the point earlier that sometimes the relationships that count to us most, we're often not, it's the whole idea of taking things for granted, right? We all do that. And yet those are the relationships that we need to be spending, like it just feels, and it's Valentine's Day, wow, it just all fits together, right? I mean, the people that we love the most are oftentimes the people that we don't spend as much time or thought about what's going to nourish the relationship. And this is fundamental to all aspects of our well-being. Relationships at work, relationships at home, these are the things that make our lives meaningful. That's the heart of what caring is about. And so the nourishing of the relationships and nourishing relationships doesn't necessarily mean, again, taking a lot of time. It means taking some thought and what it is that you can do to make people happy. And then, of course, what will they pay you back with? Love. It's cool. Manage and align expectations. Even the most expensive clock still shows 60 minutes in every hour. That's one I still don't know. I still pack my schedule way too tight, thinking I can get way too much done in the little bit of time I've got. How many people end Sunday night thinking, I didn't get done what I wanted to do? Okay, so what we need to do with that is to start our Fridays or Saturday mornings with a different expectation and a different prioritization. Maybe the sweeping or the vacuuming can wait, maybe that walk with the kids can't. Who's going to notice if you make a change? I used to smoke. I remember when I quit smoking, it was such a big deal for me. And guess what? No one noticed, right? If you make a behavior, and I picked this slide because look at this wonderful thing that this young, I'm not sure if she's a girl, I think she's a girl, is doing. And look at the people behind her. No one's even looking, right? So if you're going to start looking after yourself, and you're expecting people to notice that, yeah, you started an exercise program or you're starting to take care of yourself, the chances are that people probably won't notice. Even if you're in a good mood, more than you used to be, people probably won't notice. And that's okay, because I'm just, again, in terms of aligning expectations, the only other thing I can add to that is that if you do want to make a change in self-care, it's often a good idea to involve other people. So I know a number of physiotherapists, for example, at the rehab center, they do a noon hour walk. Now, if you think this is a leisurely stroll, you'd be mistaken. Those people move, and boy, I don't know how they manage to have a conversation while they're moving, because they're just going almost at a jog, but they do. So they take a little bit of time out of the day, it's maybe 20 minutes, they go for a really vicious walk, and it adds to the quality of their day. But, I mean, so sometimes we do notice what people do. I remember working with a nurse on one of the units when I was at the rehab center, and I noticed she always took her breaks by one of the, and this in the wintertime, by one of the windows. She literally put a chair in front of one of the big windows away from everybody else and sit there for 10 minutes. And I thought, wow, that's really cool. I noticed it. I don't know who else did, because she went off by a little corner by herself. But what I'm saying is that even if you make a big change, it may not be noticeable. This slide is called Blind Moves, and I use it to illustrate the idea of thinking outside the box. Many people I know, I think the example of Dr. Gretchen Conrad, that's doing something very, very different. But there's often other ways of doing things different. I know that people who have introduced an exercise program for themselves, at the same time they've introduced an activity for their children. So there's lots of different ways of being active and taking care of ourselves. Compartmentalization. For me, I think one of the biggest aspects of, I mean, there's the unpaid overtime that you do when you stay late, but the biggest unpaid overtime is when you're thinking about your job and you're not at work. When you go home and you're supposed to be with your family or relaxing or doing something else and you're thinking about your job. It's really sometimes very, very hard to turn things off. So what I do is I use a cue. I use my car keys. I live in Chelsea, so that's quite a drive. And I allow myself to think about work if I'm going home in the car. But I use the keys when I turn off the ignition. I say, okay, now this is my time. It's not work time. It's time to be with my family. Or if no one's home, in some rare instance, it's time to be by myself. Now, does that mean I never think about work after I've taken my keys into my hand? No, but it defines it. It tells me, no, this is now my time. That's their time. That's already been done. There's lots of different ways that people compartmentalize. It can be spending 5 to 10 minutes before you go into the house just sitting and contemplating. There's many, many things. What you will do, it's hard to say, but most people do have difficulty not having these intrusions of work into family, or vice versa, family into work. Self-talk, well, in a sense, we're talking all of the time. That's what we've been doing for this last little while. And there's many different, you should have heard my self-talk in the car when I was stuck there, right? I mean, it would go from, I can't believe I'm going to be late for my own presentation, okay, which isn't helpful, to I can probably make it. I also had to do something else. It's very slippery out. I wanted to speed. I really wanted to speed. And I had to talk to myself and saying, having an accident's not going to get you there any faster. Right? So it's at times like that self-talk can be, you have to listen to what you're saying to yourself to know how to counter it, okay? And I can't tell you how many times the coin flipped back and forth in that too long it took me to get here. This is a slide I took from Gretchen Conrad with her permission. I was shocked to find out that 25% of people working in healthcare environments carry over vacation days. I was shocked to find that out. I don't carry over vacation days. I would encourage none of you to do that either. I mean, really, that's it. The other thing is what do you think's better, to take a long weekend for the whole summer long, or to take 2 weeks off? 2 weeks off. Did I hear 2 weeks off? Yes, you are right. You are right. It takes a long time. Stress causes changes in our bodies. There's cortisol coursing through when we're stressed. And it takes a long time to get that out of the system. 3-day weekends won't really do it. So it is actually better for your health to take a longer vacation. And regular vacations for men, you get lower risk of heart disease, and regular vacations for women can cut the risk of death. Okay. Now, if you want to analyze that, you don't have to go back too much further than thinking it's all got to do with stress. Right? That's the key pin in this, keystone. Appreciation. Now, I may live in Chelsea, and that causes me problems like I did this morning, but that's the view from my front deck. So for whatever you do, whatever value you have, you're going to set it off with something else. I choose to live there and pay the price of the commute because of the view and because of the environment in which I live. The irony to that is that people will come to my house and Google and gaw, and then I'm sort of going like this and looking through their eyes at what they see, because sometimes I don't see it anymore. And isn't that true? We talked about that with family. Isn't that true for everything in life? That we sometimes fail to appreciate all that we have. And sometimes it takes hearing about a disaster somewhere else, or traveling to a country where people are not as well off, that we recognize how lucky we are to be in the world that we live in. I also wanted to mention something about resilience. People think, or have come to think, that resilience is something that belongs to an individual. Like an individual is resilient or they are not. Resilience comes actually from dealing with challenge. So resilience is built. You're not born with it. It's by facing challenges that you become resilient. So whenever you find yourself in a situation where you're feeling anxious, feeling stressed, feeling like you can't cope with work, you can look at that as a bad sign, or the self-talk can be, this is something I need to learn how to deal with. And when you do deal with that situation and you come around the other side, that builds resilience. It's by dealing with challenge that we become resilient, not the other way around. It's not that, you know, it would be like, anyway. So one of the things that resilient people do is they know how to go to the resources that sustain well-being. And those can be psychological, social, or physical. And so there's, again, the idea of psychologists often see psychologists. You can say, well, you're a psychologist. Why do you need a psychologist? Well, it's the same reason dentists don't drill their own teeth, right? Just because you're a psychologist doesn't mean you can do your own psychotherapy. So all of us need to know that we can benefit from help, and we all need to know when and how to seek it. And caring professionals often are slower at doing that, right? And we also have to have the capacity to negotiate for these resources. And relationships, by the way, are a key protective factor for everything in life. Everything. Relationships. So, in fact, it's not just the positive relationships that you have, it's also the support you provide others. I will put a caveat to that, though. If you have a lot of friends and they're all what you might, are all looking to you to provide them, like if you become sort of I don't know, I'll call it the mother of providing other people with care, and that's the kind of friends you've surrounded yourself with, that can be taxing in the long run. It's better if you've got friends that you can share the hat. They need support, you need support. They need support. It doesn't have to be equal like that, but you know what I mean in the long run. So social support provided contributes to positive relationships, but there is a limit to that. This is the work by Daniel Gilbert. People think that happiness, that, for example, people that win the lottery will be happy. After 6 months, they're no different than they were before. People think that if you have a spinal cord injury, you will be depressed. I talked about that already. There's no indicator that that's going to be the case. People assume that if you were put in prison for 10 years because it was unjust, you will be miserable. That's not true either. So Daniel Gilbert goes through all of these assumptions we make about happiness. The key is that if you want to know what is going to make people happy, it's got to do with their social network. And if you look at what we consider to be the worst or the most horrendous human punishment, it is banishment or solitary confinement. And that's because we are so linked to one another. Okay, so how do you cultivate well-being and resilience? This is what you would think of initially as a simple-minded little approach. For every day for 3 weeks, they had a group of people do this. They jotted down 3 things they're grateful for. We talked about gratitude. Write a positive message to someone in your social support network. Meditate for 2 minutes. Exercise for 10 minutes. And 2 minutes at the end of the day describing your most meaningful experiences in the past 24 hours. After 4 months, participants had substantially higher scores in optimism and life satisfaction. Cool. Okay, so you owe it to everyone you love, including yourself, to find pockets of tranquility in your busy world. Have a fun, loving weekend. Thank you very much.